welcome to DC2B Revolution. I'm Noah Volz, and today we're thinking big to live large. So I have the great honor to be with Dr. Perry Nickelston. He's a chiropractor who focuses on performance enhancement through programs he's created, like his Core 4 RRTT Recovery and Regeneration Program and the Primal Movement Change Rail Reset System. He's also the owner of Stop Chasing Pain and director of clinical protocols and training for LiteCure Medical Lasers. Thanks, Dr. Perry, for being here.
Oh, thank you so much for having me on. I'm looking forward to it. It'll be a lot of fun.
Awesome. Well, I feel like there's so much I could ask you about because you have so much great information to offer. But I wanted to focus today on your work with LiteCure Medical Lasers. And so I was hoping that you could tell me and the audience a little bit about how lasers can help with performance enhancement for athletes and then also for just normal people.
Sure. I think that's a great question. Well, I think it's best if I share my story, my journey into how I got into them. I was what you call an early adopter of laser therapy. I've been using them for 12 years now, I think. It goes by fast. I started using them for myself first because I had some severe back injuries as a chiropractor, which is not unheard of, right? And I herniated my L5S1 for like the third time, and then nothing was really helping it. And I was recommended to use a laser on my back at the time. And I said, yeah, I'll try anything, right? And at the time, I was using a 4-watt laser. So lasers are, I'll get into it later, determined by power, right? And I did like 5 sessions on my back, and I was probably 80% better after that. And I'm like, I was literally astounded. And I said, well, you know, let me use that a little bit more on some clients because I want to see if maybe I was just some, you know, crazy unicorn case, right? And I began to use it on some of my more difficult clients that I just kind of hit the wall with on traditional modalities. And the majority of them, not everyone, because no modality works for everyone, felt significantly better. And they actually felt better, but they began to heal too, because the light has a healing property to it by what the wavelength of light does to tissue. And honestly, at the time, this was 12 years ago, I was struggling in practice at the time, to be honest with you. I was probably going to end up having to close my doors because of just many different factors. And then I said, well, okay, how much is this thing? And they said at the time, it was priced higher because they really weren't out there a lot. It was $18,000, $17,900 for me to get a 4-watt laser, which, you know, now you can get them up to 60 watts. And when I hit the floor, I was like, oh my God, I mean, I can't afford that. But a friend of mine convinced me to say, listen, I think, because it helped him, I think you should do this. And I bit the bullet, took out a lease, and it was the smartest decision I ever made. I didn't let the fear of the price tag outweigh what I saw that it could do for people. And I fell in love with it. And then I started to learn from the greats, especially in Europe, because that's really where it was pioneered from. And it really wasn't here in the US. And the ones they had were such low power ones. They use them very differently than you do with the high power ones. I mean, they all have some benefit to them. You just have to use them differently, and they can be applicable for different things. And I got to say, it's probably the smartest decision I made from a business standpoint, because my clinic became super successful and I stopped taking insurance and I went all cash. And I began to specialize in treating very difficult, chronic, hard to fix cases that most people couldn't help because I had something most people never used before. But it was also probably the best decision I ever made because there's so many people that I was able to help that could not be helped before, that had been through a lot, kind of lost hope. And that's why we got into this business, right? I mean, we got into it because we wanted to help other people. And I didn't let that fear of, I don't know if it's got a lot of research on it at the time, and had quite a bit, is even more now to show the validity of the laser, which is very, very cool. But I never let the fear of the price tag stand in front of my way either. And then now, fast forward 12 years later, I have a 25-watt laser, and I'm now director of clinical protocols for LiteCure. The reason is because I personally like this laser the most. It's been the most successful for me. So I'm the guy that puts their protocols together. I'm the guy when somebody calls and they want to see, how do I treat somebody? Can it be helpful for this? My phone rings, and then I'm there to help give advice for that, right? So I think maybe to then lead into what your next question was, is how can it benefit chiropractors who use it? One, well, I mean, it's definitely going to help you help people. And when you can help a lot of people, especially people that couldn't get help from any other way, there's this beautiful thing where they like to tell a lot of other people that, right? So you end up having a very successful practice. Also by offering them a modality that truly works if you get the right one and you use it right, so you can still keep your integrity and your character because you're using something, one, that works, and two, I did because I truly believed in it with everything that I had. And then the light itself just helps stimulate the body to regenerate and heal itself. And we can get into that more if you want to ask me the next question, because obviously you can see I like this stuff and I could just keep going. I'll wait for your next question.
Awesome. Yeah, when I did some research on you, you're all over the place. You've written for every, magazine. You've taught at so many different places. So to hear you say that you were really struggling, at that time in your life, just was such a surprise to me. So I'm so glad that you found lasers and you found a way to make this authentic contribution to chiropractic and to, the healing arts as a whole. So that's super inspiring.
Well, I think that's important. That's important for practitioners to know of all different levels, especially students, because you're about ready to take a big step, out into the world from school. A lot of challenges, and the scene has changed a lot over the years. And people are not really super successful when they first come out. Look at any entrepreneur who's really made it. They've had a lot of failed attempts at first, but it's what you take from that and learn from it, and you don't quit and give up. And I kind of jokingly say, hopefully it's okay for me to curse on here, that the universe, its job is to really kick your ass, right? And then see, are you strong enough to keep going after your purpose? And I think when it kicks your ass, it helps you find your purpose. And for me, it was the laser and then looking at the body in kind of a unique way. So I'm actually very grateful that I got my ass kicked early on.
Yeah, it seems like that really built some resilience for you and allowed you to, hone your purpose and allowed you to keep moving forward. So I wanted you to talk a little bit about lasers and about the LiteCure laser, the class 4 deep tissue laser that you use, and how it compares to other lasers, and a little bit about the wattage and kind of just the science behind it.
Sure. Well, I think it's important to say that every single laser that you get from a therapeutic standpoint is going to have some benefit. They all work, right? It's just what they're able to do, what conditions you can actually treat with them, and then how well your results might be. Because you have to have the right tool in order to get the right job. What I mean by that is that, I might need a hammer for something, but I also might need a bigger hammer, like a sledgehammer, to tackle a bigger problem. And it's the same thing with laser. So lasers that are therapeutic are called that because they have to fall within some spectrum of light, and that's called a wavelength. If you are not in the spectrum of light, then it's not therapeutic. Right? Then you've got some that maybe are really, really bright, like a laser pointer, for instance, right? And they're super low power, but their wavelength is low and it's super bright. And then when you change wavelength, you also change your color spectrum. It can go from green to purple to red, right? And then you've got the sweet spot of the therapy one, and all the lasers have to be somewhere in here. Where they fight is that it's this one that's the best or this one that's the best. I mean, they're all going to help you. But then if you go higher outside to the top of that spectrum, then you don't see anything at all, right? And then you also, it's very focused, and then the body absorbs that light very differently, and it's focused into a smaller beam most often. Those are the ones that you may have heard of that are surgical lasers, right? And they're designed to cut tissue. The therapeutic lasers will not do that, and they're not going to damage the tissue if you use them correctly. I always tell anyone is that any tool, if you don't use it the way you're supposed to use it, or you haven't gotten trained on it. If I give a kid a hammer, he's probably going to mess himself up or hurt somebody. It's the same thing with any tool that you can hurt somebody. You can cause damage, or you might not just get the same results because you're not using it as efficiently. Lasers are therapeutic first. Then you've got the big debate is how much power do you need to accomplish the task of the treatment? And then that's where you have lasers that are called cold lasers or low-level lasers. And they range anywhere from a power scale on wattage. And most started out at half a watt, which is 500 milliwatts. It's a pretty good amount of power. And that's going to get into the tissue a little bit. And then they started to extrapolate out by looking at what they're doing in Europe, where they started going higher and higher and higher and higher. And then the government here in the US started to permit more power, more power, more power. And then now when you have a higher power, they can go up to 60 watts. I mean, they can go really, really high anywhere along that spectrum. And once you have to have the wavelength first, if you have the wrong wavelength, it doesn't matter how much power you got. It won't do anything. Then it's the power is like, hey, I can use that power to drive the light that I'm trying to heal the tissue with to a lot more places in a shorter period of time and to deeper structures. The easiest analogy I can make is like a water hose, right? I mean, you've got water molecules coming out of the hose. When you've got a laser, you've got photobio molecules coming out of there, right, of light. And I can take a low power hose and then, you know, I can get some water out, but it ain't going to go that far. And it's going to take me forever to water my grass, right? And then I can put a really lot of power behind it. And then I can shoot it a lot further and I can saturate my grass a lot faster. So the power aspect comes into play because you can treat more of the body and treat it in less time. But because it's higher power, it's higher technology and it costs you more. And, you know, I've used both. And the laser that I have, the reason I like it so much is that I can go high or I can go low. I can take mine to 25, which I think is plenty for most people, all the way down to half a watt. I can choose anything I want. Basically, it's like having the garden hose where I can click that thing, bing, 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 and get whatever I want out of there. So no matter what I need to treat, I can do that. And it's a safe modality that will, you know, doesn't hurt you. And the high power ones, some of the things that people get nervous about with a high power laser, we call it high intensity class 4, where it gets hot. And they say, you can burn somebody with it. I'm like, well, of course you can if you're an idiot. I mean, you know, you got to pay attention to what you're doing. But if I put a hot pack on you and I don't pay attention to how I put it on, I'm going to burn you that way too. I mean, there's no excuse for being a moron. You have to get the training that's required in order to use the piece of equipment the way you want to. And I've just, by experience and by results and by working with people in other countries, I've subsequently gone higher. But I also think that there's a point of diminishing return where just because you can go higher beyond a certain point doesn't mean you need to, but you still have to have your baseline of that. So what I mean is that you're going to help people for sure with low-level lasers that are 500 or a watt or less or anything like that, and different types. It's just you're going to have a degree of variability in your outcomes, and also the things that you're going to say, well, I treated elbow tendonitis pretty well, but when I went down to do something for the low back or the spine, it really didn't do that great. You may have that happen, if that makes sense. You know, it's just choosing the right tool for really the conditions that you want to start to go after, basically.
Yeah, and it sounds like there's a certain amount of that, you know, clinical decision making that takes place. Like you've had so much experience, you've done this for a long time, you've worked with a lot of different lasers, and so over time you've developed these protocols, you've developed this kind of way to think it through. And so, you know, it's a skill like anything else. The more you do it, the better you get at it, the more you're able to see like what wattage to use for each, you know, different thing that you're working on. One question that I had for you was about the wavelength. Is the wavelength of all the therapeutic lasers the same, or are there slight variations in the wavelength as well?
There's slight variations in them. You know, when you look at what they call a nanometer, that's really the spectrum of light. When you get a laser, it's impossible to just definitely target one wavelength. It's going to go up. It goes plus or minus 10 to 20 nanometers. So say if I've got, they're usually going to go anywhere from, some people mix the different wavelengths together. You know, you've got a low one, like that's in the 600s or the 800s. And then that light is absorbed, differently, a little bit more superficially, right? And then when you go higher up, it changes how deep it goes, and wavelength makes a difference on what structures in your body absorb the light, right? Because you've got to get in that spectrum. And this is kind of debate where somebody says, I've got the magic, you have to have this magic wavelength or it won't work. First of all, that's just a lot of marketing stuff. You're going to have to be in this spectrum. As long as you're in here, and then you have to have that first. But then you have to be able to get the dose to the target tissue that the person needs. I hate to use an analogy in medicine with like drugs, but it's the easiest way for you to get it. Where I know if I've got the right antibiotic, let's say I need to give you the antibiotic, right? But if I don't give you enough of that antibiotic for your body type and your body size, it's not going to help you get rid of the problem or the illness that I'm seeing you for, or kill the bacteria. So it's dose dependent. Biology is dose dependent with everything. Same with the light. If I know I've got a laser and I know that you need the laser like you needed the antibiotic, certain spectrum. But if I don't give you enough of that laser light, yes, you might feel a little bit better, but you're not going to completely get over your issue. And what I've got to be able to do is have the right laser that can deliver the dose that I need to. The dose is going to change based on a few factors. The size of the person, the bigger you are, the more dose you're going to need. Does that make sense? Is it acute or is it chronic? So you need more or you need less. Also, how deep is it that I need to reach? Me doing a laser treatment on your finger for arthritis is not the same as me trying to do a deep hip structure that has bursitis. I can't deliver the same dosage here and then there and expect to get the same outcome. It makes a difference on age. It makes a difference on skin color because light absorbs differently through dark tissue as opposed to light tissue. So you have to take that into consideration. But, you have to get the dose. The most important phrase here is to the target tissue. I have to get through skin, water, blood, fat. I got to get through all that mess before I even get to what I need to hit, which could be injured, which could be deep fascia, ligament, joint, nerve. If I can't get through that, then I can't get to the target tissue. So the wavelength determines, can I actually reach the tissue? Then the big debate in laser is how much do you need to drive in through here dose to get it, right? So you're always going to have some benefit because you got the right medication, quote unquote. But the amount of results you're going to get depends on your ability to deliver what you need to your target. And I like the ability to be able to go anything I want. Like when you have a sufficient wavelength and you've got a high power laser, I can deliver that stuff 4 to 5 inches in your body, no problem. I can reach any tissue I want. But if you come on and you say, wow, my earlobe hurts right here, and I'm not going to put 25 watts on your ear, I'll maybe put half. But I can do this, and then the same person comes on in with the ear and says, dude, I just threw my back out, then I could crank that up on the same unit to 25. So there's nothing that can walk through my door that I can't have some type of influence in on laser. And everybody gets laser in my practice. I jokingly say, if you come on in with a hangnail, you're going to get a laser treatment on it. And then we always laser prior to any soft tissue work or any manipulation, because when you deliver the laser light into the tissue, it relaxes the tissue. It gets a lot of increase in blood circulation. It kickstarts the healing process by this word called photobiomodulation, which is photo means light, bio means biology, and then stimulation. So it kickstarts the body to regenerate itself at a mitochondrial level. If I can relax that first, the tissue work is not as painful. The tissue work is easier for me to do. And your adjustment goes a lot easier because I can relax all of the muscles that are guarding and splinting in an area, so I can move the vertebra much easier. And because it's relaxed, then I can do some corrective movements to begin to strengthen the area. And because you've done all that prior, it has a greater chance of holding faster and holding longer. And plus it takes pain away, which is kind of cool.
Yeah, that's really important. It seems like that's why most people come to your office, is have the pain taken away. And that's so great to know that you want to do the laser first before you do soft tissue work or the adjustment or any sort of range of motion or anything else to kind of help the tissue heal initially, so that when you do all those other modalities, it just improves the overall outcomes that you have for those different modalities. That's really great.
I think it's important to note that that's the way that I recommend it. That's the way that I've seen it through doing it for a long time, of the most successful approach. Some people have told me that they prefer doing it the other way, where they do their stuff first and they relax it later. Here's the rub. There's no wrong way to do it. You can do it pre or post. And you actually may have to change that up based on the individual, quite frankly. But I can say honestly that 99.9% of the people that I see, they get that first.
Yeah. And do you provide any nutritional recommendations for people in conjunction with the laser? I mean, is there a metabolic component in how the laser performs?
Yeah, there's always a metabolic component, chemical component, because this is going to be going down to the cellular structure in and of itself. And there's these structures inside your cell called cytochrome C. And then those are actually going to, they absorb light of all different spectrums. And then that is like a kickstart into the mitochondria. And we know the mitochondria, remember from biology, that's the powerhouse part of the cell.
Right. Cytochrome C is part of the electron transport chain, right? So it's basically building our energy supplies.
Yeah. So if you go, because the cells need that energy, that's how they're going to regenerate themselves. And, you know, it's what I love about it. It's kind of like chiropractic. I mean, we're just naturally stimulating the body to do what it's designed to do. It's just hit a roadblock, or chemically it can't do that. And then if you go on like YouTube and you can go visit the LiteCure channel, they have some really cool educational videos of stuff that kind of explain it in more detail for people. Some that are for doctors and some that are for lay people that they can get. But the biggest thing that I've seen is that, because as I work with a lot with the fascia, right, and the fascia of the body is supposed to be well hydrated, and it's usually not. And most people, when they come in to see me, they're in a perpetual state of dehydration. Now, the biggest component I make from a metabolic standpoint is just start drinking a lot more water and a lot less of the other crap that you're drinking, and then you'll see a difference. Because it's really cool where you'll see that fascia in and of itself, they see that fascia actually bleeds through and goes down into the cells themselves. A lot of these cells in the body, so fascia really goes deep down inside of anything and everything. Honestly, I don't do too much work from a nutritional standpoint in regards to health, regeneration, and recovery. That's not something that I consider expertise for me. I work with experts that I can send people to do that. I don't believe you can be a jack of all trades kind of thing. But I work more from a nutrition standpoint for people that are health, fitness, and performance. Like, I just want to look good in the mirror, or right, I want to perform at a higher level, and that sort of stuff. But yeah, I mean, and I think because it's important for me to make this caveat. Laser is definitely going to help you feel better. It will heal up tissue. It will begin to take pain away. But if that's all you do, your results long-term are probably going to be minimal, because you need to do your job as a clinician and then discover the root cause of why, for instance, my back hurts or why my knee hurts. We need to work with the nervous system. We need to reset the nervous system, do your adjustments, do your lifestyle changes, do your nutrition. So that's why with the laser, I always treat where it hurts, but I also continue to do my other skills that work with it to figure out why it hurts. And I can use the laser because it's so powerful. If I find, for instance, that your knee hurts, right? And we know the knee is really stupid because it only does what the foot will allow and the hip can control. So I'll laser your knee, but I've also got to maybe manipulate your foot or your hip or your lumbar spine, and then I'm going to laser those areas too. So then I can reset some of that fascial continuity to your knee, and you will have better results because you're not just zapping pain. And that's one of the things that I brought to the clinical applications of LiteCure that I think are very unique, is through my journey of stop chasing pain, is I've never found a modality that I've used in all my 22 years of practice that has such fantastic and fast results for pain relief as laser. But using that with my other training over the years of lasering other areas in conjunction with the side of pain, your results will go even higher. And then the power gives you the ability to do that. So because I have a 25-watt laser, I can maybe laser 6 places on someone, where someone with a low power laser can only hit the one. It's just going to be a different outcome. That's all.
Yeah, I'm so glad you brought that up. That's something that really inspires me about the type of work that you do, is that you really do this whole body, whole systems approach and look at the entire kinetic chain all the way through. And so the laser is part of your treatment protocol, but it may not be that specific area. It appears to me that you're always looking for the cause and always trying to, weave back through the different layers in the person and get them to, this place of optimal function. So, yeah, kudos for that. It comes
back to our, thank you, I appreciate that. Well, it comes back to our chiropractic paradigm, right? I mean, treat the cause, and we go down to the root of it, to the spine and to the nervous system, right? That to be able to make an impact there, and that's one way to do it, through your hands. And another way to do it is through the laser. Another one to do it is through movement. Another way to do it is just straightforward human being interaction between you and your client. But one of my favorite sayings that I always say, and I contributed to Ida Rolf, who is the creator of the Rolfing method, and it's a very simple philosophy that I live by, is where you think it is, it ain't. So you treat where it is, and then your job is to look for the ain't. School sometimes just teaches you how to treat the area that it hurts, right? Where it is. But most of your experience is going to come when you get out and you learn from different techniques or different approaches, or you treat the side of pain for many, many years like I did. And then you just started to get very frustrated of, there's got to be something a little bit deeper beyond it. I think we're way ahead of the game with our approach to chiropractic, because we treat the body as a whole from above down, inside out, right? And but you can extrapolate out to how the whole industry has changed in healthcare and stuff, to modalities you can do, but also human movement, which is a really big one that you do. So I appreciate that. Thanks.
Yeah, definitely. And so how can people find out more about what you're doing? You're doing so much great work, and I want people to be able to connect with the work that you're doing and learn more about the lasers and all the other type of work that you're doing. So where can they find you?
Sure. Well, it's not too difficult to find me if you're looking for me. Some people find me by accident, just by looking around, because I try to put out a lot of great content over the years. But typing in "stop chasing pain," you'll find something that will show up. I think maybe the first 10 pages that show up will be something of me on Google. But I also write a lot for most of the chiropractic journals and publications. So if you go to ChiroWeb is one, you can. I've been writing for them for like 7 years. I've got a ton of articles on there, and my website will probably show up first, and that's the easiest way to get in contact with me. And that'll be kind of grand central. You'll be able to spider out to see the workshops that I deliver all over the world. My upcoming book that's coming out in April called "Stop Chasing Pain." I'm very excited about that. And then also I have a exclusive, what I call GoPro membership site, where people can come on and you get a lot of content that I just don't put out there for everyone. I think I have over 350 videos now at this standpoint, and stuff come in every day. It's kind of direct access line to me. And then you can also listen to, and if people don't know about it, I highly encourage you to click on the podcast icon in my website, or just type in "Stop Chasing Pain Podcast." I have over 150 episodes, I think, now that I've made over the last 5 years, where I've done very similar to what you're doing here. Just got on the phone or got on video with some people that have inspired me, or I wanted to learn from many industries, from fitness to physical therapy to neuroscience to chiropractic to authors that just have really cool shit to share. I mean, it's free. You can see it. You can get it on iTunes, or you can get it on my website. I just interviewed Thomas Myers from Anatomy Trains yesterday, that he's going to be going on up. And then, of course, I'm almost done. You can get all my social media stuff. I'm on Twitter, Facebook, Instagram, LinkedIn. I'm all over the place, kind of like a virus. You know, you just can't get rid of me. But if you want to reach out to me, you can also get some information at LiteCure. Just type in LiteCure Lasers, LiteCure.com. People can get some demos on the laser from people. They can speak to doctors or find doctors. If anybody watches this, it might be a patient that's looking for help. You can find some practitioners on LiteCure.com by zip code. So if you're looking for help, you can actually find people that do offer the technology.
Yeah, it's true. When I looked you up, you're everywhere. So not a hard person to find, just finding the right avenue to get in touch with you.
All the juicy stuff shows up on page 13, by the way.
Okay, good to know. All right, so this has been DC2B Revolution, where I'm investing in the future of chiropractic. Thank you for joining me and Dr. Perry. And if you like this video, please subscribe to the channel or make some comments below. And looking forward to seeing you next week. Thanks, Dr. Perry.
Thank you very much, my friend. I had a great time, and thanks everyone for watching.